So thank you all for joining us for another one of our recovery work group meetings. Because we've sort of expanded the scope and membership a little bit, I do want to just go through quickly for those who are less familiar with all of the players and introduce everyone to those that might be watching and not participating. So if you don't mind, I'm going to run through quickly, and if you can just raise your hand when I get to your name and organization, that would be much appreciated. I'll start off with County Executive Stuart Pittman. Dr. Nilesh Kalyanaraman, our County Health Officer. Councilman Andrew Pruski from District 4, who I know is with us but not on screen at the moment. Sherry Perkins, President of Anne Arundel Medical Center, I think just joined us and is down on the bottom right of the screen. Karen Olskamp, who we're just congratulating on her pending retirement with the University of Maryland, Baltimore Washington Medical Center. Eric DeVito, who wears many hats, but is here as the chair of the Anne Arundel County Economic Development Corporation. Alyssa Santoro, is Alyssa on yet? Don't see Alyssa yet, but Alyssa is representing the Crofton Chamber of Commerce. We also have Bishop Antonio Palmer from Kingdom Celebration Center, and Donna Edwards, the president of the Maryland State and DC AFL-CIO. Thank you, Donna. We have a lot to cover today, and while this group normally works through things very quickly, we also want to make sure that we have time at the end of this for questions from the general public for the panel and the group. So I'm going to ask that we all work through our presentations rather quickly and that the panel discussions stay focused and the questions that are asked amongst the panel are the most critical and pressing needs that you are concerned about and think are important for others to be aware of. We've just been joined by Councilwoman Fiedler from District 5, who is our last sort of formal attendee and introduction. I really ask your help and assistance as we work through some tough times. We're always appreciative for this group and the frank and candid feedback that you offer the county executive as he walks through in some pretty uncharted waters. We're back in a place that I know everyone on this call hoped we would never be. With that, I'm going to hand it over to Dr. Kalyanaraman for what I'm sure is going to be a very sobering presentation to sort of kick us off and give us the current lay of the land. So, Dr. Kalyanaraman.
Thank you, Matt. I'm going to share my screen, so give me about 5 seconds, and then we'll be there. So thank you for the opportunity to share this information with the community. Our core principles have been to suppress the spread of the virus, to keep people healthy, preventing illness and death, to allow schools to open, to keep businesses open, and to promote mental and social well-being. And these goals really shouldn't be in tension when we control the spread. Schools and businesses do much better. And we really think of this as an investment. The more we invest in the public health side of this, the better our results everywhere. And prevention is really our goal. Just a brief overview. It's a new virus. We are in our 12th month of this virus, but it has changed our entire society and our world. We had our first case in Anne Arundel County on March 11th, and since then, as of today, there have been 14,931 cases and 276 deaths. I think it's important in this season to just remind everybody of the symptoms. It's a wide range of symptoms. It's cold and flu season, and some of these overlap with colds and flu, and some of them are unique. Symptoms typically occur about 2 to 14 days after exposure, so a wide range of time, 2-week range, but average is 5 days. Fevers and chills, cough, shortness of breath, those are some of the most common, but we also see fatigue, muscle and body aches, headaches, a new loss of taste or the sense of taste or smell is pretty specific to COVID, and we're hearing a lot about that. Sore throat, congestion or runny nose, nausea, vomiting, diarrhea. As you can tell, a lot of these symptoms are pretty nonspecific. They happen in other conditions, and that's one thing I'm going to talk about in a minute. If you have symptoms, don't dismiss them. Don't just say, oh, it's just a cold. Get tested immediately, quarantine while you wait for results. If you're positive, the health department will contact you. But if you're negative, continue to quarantine. You don't want to spread what you have to others. And regardless of the cause of your symptoms, seek medical help if you need it. And I bring this up because we're seeing a lot of people who are testing positive for COVID who thought it was just a congestion or just a little cough. And it turns out they're spreading it to other people. So the more diligent you are about this, the better. What do we see with COVID? Most people who are infected with it have mild to moderate symptoms. They fully recover in 2 weeks. But there's about 10 to 15% of people who have severe disease that requires hospitalization. And as you'll see, the more cases we have, that means the more people who need to be hospitalized. And about 5% become critically ill. There are long-term effects of COVID. It's not just full recovery or death. For people who are hospitalized, most of them have long-lasting symptoms. Common ones are fatigue, shortness of breath, cough, joint pain, chest pain. But some of the less common symptoms, but more debilitating, are cognitive impairment, so having fuzzy thoughts, depression, muscle aches, headaches that last for a long time, fevers, and palpitations. So I think the point of this is that COVID-19 is not the flu and it's not the cold. It's its own type of disease. And flu and cold don't have long-lasting symptoms once you get over it. And just as concerningly, it's deadly. It's the 4th leading cause of death in our county this year, and we're not done with the year. It's the 3rd leading cause of death in the United States. And what you see here is the blue bars are data from 2018 on the cause of death, and that's the last year for which we have data. And that red bar is COVID-19, so that's this year put onto that 2018 data. And as you can see, it's just behind cerebrovascular disease, so strokes. And unfortunately, our trajectory is that we're heading towards that by the end of the year. This is a deadly disease. For comparison, flu kills an average of about 11 people in our county each year. So where are we right now? We're seeing that our new cases are skyrocketing. You can see in the last month that line is orange line is going up. Today, our case rate is 32.9 per 100,000 people per day. We had 271 new cases today, which shattered our previous record for new cases in a day. We're seeing our hospitalizations go up over the last 4 weeks. We're seeing that same trend in the state as well. We're seeing our percent positivity go up. And that's now at 6.5%. And that's a way to tell if we have enough testing. We have been increasing testing, and despite that, we see our percent positivity going up. And our infection rate, which is an indicator of spread, is at 1.2. Anything above 1 means that the virus is spreading more and more rapidly. The higher you go above 1. Anything below 1 means that it's spreading less rapidly and will actually shrink. And so being in that high range is consistent with what we're seeing. And this is our deaths. We have seen definitely in the past 6 to 8 weeks an increase in the deaths. And given our case rate, we know that we're going to see more because of how high it's gone. This is some data from our contact tracing. This is high-risk locations where people have been in the 14 days. People who are positive have been in the 14 days prior to their diagnosis. Work outside the home is the largest category. Followed, number 2 is indoor and outdoor dining. Third is retail shopping, and then 4th is outdoor recreation. And this is a recap of the data that I just shared with you. We will be posting these slides online after the end of this Facebook session. And so the key principles that we're really looking at are that hospitalizations are increasing rapidly. And at this pace, they'll exceed the number of beds in the state, the hospital beds in early 2021. And we're going to show some projections in a minute. A key thing to remember is that there's a 2-week delay between each of these steps. So when cases go up, it takes about 2 weeks, maybe a little longer, to see that reflected in the hospitalizations. It takes another 2 weeks to see that reflected in the ICU. And then it takes another couple of weeks to see that in the deaths. Sometimes it takes a little longer. Our hospital care has definitely gotten better since the beginning. We're keeping more people alive. More people are able to be discharged. But that's the general lag we see. And I think the other key principle is that the effectiveness of our actions multiply over time. So acting sooner will save many more lives. You can think of it like investing. If you start investing earlier, you'll have more money at the end. If you start with your safety measures earlier, you'll save more lives in the end. And so these are the projections that I was talking about. And these are projections that come from Johns Hopkins. This is a 3-week projection. It shows a couple of things. One, that blue line, that thin blue line, is what we saw in, as you can see, from March 26th to May 6th. So at the beginning of the pandemic here in the county, sorry, here in the state. And these are state numbers. Those thick blue bars are our current hospitalizations. As you can see, we're trending along that thin blue line. And it says that in about 3 weeks, we'll be at about 1,800 beds occupied in the state. Right now, we're in the 1,100, actually close to 1,200 at this point. If that trajectory continues, what the projections show is that if we don't make any changes and we continue along this pathway, in about 3 to 4 months, we can expect to see 15,000 hospitalizations. That's why it's so important to act, to change that trajectory. This isn't a prediction of what will happen. It is a projection of what would happen if we did not take action. And so that leads us to 3 areas: individual actions that we all need to take, wearing a mask when you're around others not in your household. That is the single most effective thing that everybody can do. It may be inconvenient, but it is going to save lives. Avoid gathering in indoor spaces with others outside your household. Limit activity and travel. Get tested if you have symptoms or are concerned about your exposure. I think it's really important. Thanksgiving celebration with your household only. And in fact, the CDC just earlier today released that as their recommendation for the nation. Public health actions that are coming is establishing a system to provide COVID vaccines when they're available. We have that system in place in our county for when the vaccine is available. We know that there are many people with concerns about the safety of the vaccine, and we will be addressing those concerns in the coming weeks and months. Increased use of rapid testing. We have rapid testing that we acquired, and we are looking to deploy that in December. And then focusing on equity by providing targeted interventions to disproportionately affected groups. We know that this virus has hit Black and Hispanic populations much harder than the general population, and also affected lower income earners as well, harder than the general population. And then targeted actions, and these are based once again on those on the Hopkins projections, and these are their recommendations for actions to take to change that trajectory. Closing venues that lead to a high number of contacts, such as restaurants, bars, movies, theaters, religious services, etc. Limiting gathering size to 10 people indoors, and increased enforcement. And the idea behind this is that places where there are large numbers of people gathering together who wouldn't otherwise do that, and particularly indoors, are disproportionately fueling the spread of COVID. And targeting those very specifically will lead to the greatest gains in terms of slowing down the virus spread without affecting the entire, while being targeted in terms of its economic impact in our county. And so that's what I wanted to share with you today. I do want to acknowledge Drs. Ellie Klein and Gary Lynn at Johns Hopkins Medicine, who provided these projections and their target recommendations for their guidance during this time. So I will stop share. And turn it back over to you, Matt.
Thank you very much, Nilesh. Before we begin the panel discussion, we wanted to, and the county executive's comments, we wanted to run through one other piece of context for the panel to consider before we start some of our deliberations. Chris Trumbauer is going to run through a little bit of the regional context. The fact of the matter is, since midsummer, we're combating a 21st century virus within the confines of 18th century boundaries. And so we wanted to give you a little bit of context for what our neighboring jurisdictions are doing and where they are. And then we're going to have the county executive give some thoughts and feedback on both of the presentations. Chris, do you want to share your screen?
Yeah, thank you, Matt. So hopefully you guys can see this. And what the county executive asked us to do was pull together a simple comparison of the big 7 counties, the ones with the most population, for several different categories. So what you're seeing on your screen, hopefully, is a chart. This particular one is for food service establishments. So the color coding here is if you see something in green, that generally aligns with the state, which is the far left of the chart. If you see something in blue, it's local restrictions that are more strict than the state. And if you see something in yellow, that means it's something that's less restrictive of the state, which will obviously become obsolete and superseded at 5 p.m. tomorrow when some of the state things go into effect. So if you look at food service establishments, you can see 4 counties, Anne Arundel, Baltimore City, Montgomery, and Prince George's, have stricter provisions than the state does in capacity, and in alcohol service, a couple of counties do too. But this shows the most recent actions taken by the state. If we go to the next category in gatherings, you can see for indoor and outdoor gatherings, all the big 7 counties had policies in effect that are more stricter than the state. I think in the most recent announcement, the governor had some guidance of 25-person limit, but that's not in the executive order. And for the religious institutions, the state's at 50%. Several counties are more strict than that, and a few of them will get superseded when that goes into effect. Moving on to sports and recreation. This one is a little bit of a hodgepodge because there's so many particulars, but the take-home point here is you see all that blue means that just about every jurisdiction has put regulations on sporting events and indoor rec and outdoor rec more strict than the state has. On performance venues, this is for indoor theaters and outdoor venues. Some jurisdictions are still sticking with the state, but a few of them have gone more strict for a 25% capacity, and Montgomery even has closed indoor gatherings. And then finally, if you look at retail and other establishments, what you'll see is the state action of 50%. That brings us to where we were in Anne Arundel all along, and it is going to conform several of the other counties that were at 75% to be back down to 50. But Baltimore City and Prince George's were more strict than that. So I think the overall take-home message here is that most of the big 7 jurisdictions have acted more strictly than the state has, and that shows the need really to work together. I think part of the story is because the counties have had to act individually, there are some differences and inconsistencies among them, which I think can be confusing to the members of the public trying to follow the rules in different jurisdictions. But as Matt said, the boundaries of counties don't really matter to the virus. And we thought it would be helpful for the group to see these different charts of what's being shared. So that's all I had. Thank you, Matt.
Thank you very much, Chris. County Executive, we want to give you an opportunity to give some opening thoughts to the group, and then we'll open up for broader discussion and questions.
Okay. Yeah, thanks for sharing that part, Chris, because most of the time recently that this group has been getting together, we have been talking about reopening and what's the appropriate pace of reopening. And those have been difficult conversations. And now things have shifted. So nobody's reopening right now. And it's a question of what needs to get closed to be able to push these numbers down. And I do want to put a little bit of perspective in about where Maryland and where Anne Arundel County stand. Across the country, Maryland is 37th in terms of case rate. There are 36 states that have higher rates than us, but we're actually 11th in terms of rate of spread, the infection rate. So only 10 states are spreading faster than Maryland. And then in the state of Maryland, Anne Arundel County, we have actually dropped, as have most of the Central Maryland counties, in our rankings of infection and case rate because we acted, and the outlying counties have actually risen. So most of the highest rates are the counties that did not act more quickly than the state. So we're ranked 9th in case rate in the state of Maryland of 24 counties, with a rate of 28.7. The state rate is 31.6. And on the rate of infection, we're ranked 14th in the state with an infection rate of 1.21 compared to 1.24 for the state. I don't even think that looking at these rankings across the state makes any sense at this point. We are all in this together as a state. In fact, it's the smaller counties that have fewer hospital beds that are in the most trouble, which is why the governor has created a system to move patients from between hospitals and between hospital systems when beds are available. They're calling it the matchmaker program. But I want to give a little perspective on what it means, these modeling projections that Dr. Kalyana Raman just gave us from Johns Hopkins that suggest that we could be looking at 15,000 COVID patients needing hospital beds by mid-February. That's a very, very scary number for the state of Maryland. I read yesterday that right now there are approximately 800 open hospital beds that don't have patients in them, open and staffed across the state, that are available. And so the governor has asked hospitals to start reducing the number of surgeries and try to reduce their hospital census without requiring it like they did in the spring. I'm told there are another 2,500 beds that are unstaffed and another 2,400 space for another 2,400 beds that don't exist yet that are unstaffed. So the state of Maryland just doesn't have the capacity to handle 15,000 COVID patients, which means that our only option is to push these numbers down, is to act, is to prevent that from happening. So, as government, we can do a couple things. We can close down businesses and particularly businesses where people gather. And that's one of the recommendations from Johns Hopkins. And I believe that actually a lot of our businesses have learned how to operate safely in this pandemic. And the cost of putting people out of work is pretty severe as well. The restaurants and the bars are places where people don't wear masks, can't wear masks while they eat and drink. So all of the health professionals tell us that that's where we should focus first when we have to close businesses. You've seen all of the Central Maryland counties have limited social gatherings to 10 indoors as compared to the state at 25. And to me, 25 people gathering in somebody's home in this pandemic is probably not a good idea. Here we are in Anne Arundel, and I've been talking to county executives across the state and in Central Maryland and trying to figure out what to do next. And the conclusion that we're all coming to is that we really need to do this statewide for it to work because of the boundaries, the 18th century boundaries that Matt talked about. So we are always asking the governor to lead, and we will continue to ask the governor to lead, and we believe he will because he's seen these numbers as well from Johns Hopkins, I assume. But the other thing that we can do as local government is to tell the true story. And that's why we're sharing these modeling projections, because if people don't know what the danger is, we can't expect them to make sacrifices to prevent that danger from happening. So that's why we just shared that information with you. I hope that some of you, people on this committee as well, took a few minutes to look at what we put out Tuesday night. We had a COVID impact town hall with about 7 or 8 people, health professionals, families who lost loved ones to COVID, people who battled COVID themselves. And to me, that was enough to really give me a jolt. And I think most people who saw that realized that this is a very, very serious virus. And we're going to continue telling those stories. And in fact, we've contracted with a marketing firm to help us do that. So we're going to be continuing to put out videos of people telling their stories, as well as just guidance. We have a toolkit for people to use with posters and social media posts about social distancing and mask wearing and everything that we can do to keep ourselves from spreading the virus. And so we have to change hearts and minds, and we have to convince people that this is not political. This is not about freedom. This is about saving lives. And I think everybody who's part of this committee knows that. And I just want to continue to spread that word and ask everybody to help to spread that word and share the materials that the county's putting out, because ultimately that's what's gonna crush the curve. So I'll stop on that and look forward to what everybody else has to say.
Thank you very much, County Executive. I am going to open it up to the group for maybe 5 minutes of sort of the most critical thoughts, comments, questions, because we have one last presentation to get through, and we want to make sure that the folks that have joined us live via Zoom or Facebook have an opportunity for questions. So with that, I'll open it up to the group for Councilwoman Fiedler.
Thank you. Appreciate all that information. When I saw the recommendation from Dr. K, just one thing popped into my mind. I know we've talked a lot in this group about the timeline when any kind of action is taken. We typically do not see the results of that action for 10 days to 2 weeks. Knowing that your executive order isn't going into effect until tomorrow at 5, I just have concerns if are we talking about taking more restrictions before seeing what the executive order that goes into effect tomorrow, what that does. That's just my initial thought of perhaps waiting and seeing what those additional measures do before we start making more closures.
Thank you, Councilwoman. I think the answer to that is that's what we're here to talk and discuss and get feedback on. Other questions or comments or critical points? Okay, thank you for the panel members for sparing their time for others at the end. We're going to go on and have Preeti Emmerich, who is the director of our Office of Emergency Management. A number of the panelists here have are already aware of the work of county government and the structure we have in place to sort of address COVID on a broad scale. But she's going to run through briefly for those of us who are less familiar of sort of that structure, and then the county executive is going to talk about why we've sort of opened up this group and how we're going to fit it in the context of what we have going on at the county level. So Preeti, do you want to share your screen and move us forward?
Yes, I will. Can everyone see the slides?
Yeah, you're good.
So as the county executive said, and Dr. Callahan and Raman, this is quite a unique situation, and the framework that we have built for it will accommodate the response and recovery, as I like to call it, ebb and flow. So in terms of the recovery continuum, and what we have here is that in a normal recovery after a disaster, the disaster ends, and there are different time frames for the recovery. We have short-term, intermediate, long-term, and there are different actions that can be taken. Of course, here COVID-19 has not ended, it's going to be continuing. So what you find is that we have a commingling of the short-term, the intermediate, and the long-term coming together. So just more of a perspective, this graphic is from the state, and it gives more of the public health perspective on it. So what we see now is we're kind of in between the short term, if you believe it or not, and the intermediate recovery, because we have the second peak. Hospital surge is still needed. And if you look at the long-term recovery, we have vaccination planning, which is starting. So again, is that ebb and flow of response and recovery. So some of the guiding principles we have for our recovery, and they're listed here on this PowerPoint. Continuity, again, ensuring that our county services and resources are still provided to residents of Anne Arundel County. Health equity and inclusion. We want to make sure that everybody reaches their full health potential. And inclusion, as Dr. Kalyana Raman pointed out, this virus does affect certain populations more. So we want to make sure that our actions reflect that. Resiliency, again, building back better. We want to make sure that the actions we take will put Anne Arundel County not just back to normal, but in a better place in all areas. And the whole community. One of the things we've seen with the response and recovery of COVID-19 is that the community is involved. The community wants to help out. And in the actions we take, we want to make sure that the whole community is involved in what we do. So here is the framework of how we're going to have our vision, support, and execution. And as you can see, with the county executives as leading this vision and policy, with the COVID-19 Recovery Advisory Group, of course, advising him on the vision and the policy. We do have a Recovery Executive Committee that takes that vision into consideration and develops the policy or helps enforce the policy. As you see in yellow, the support team comprised of the Office of Emergency Management make sure that that vision and policy is known to as we go to the execute team. And as you can see with the the mission areas, there are 4 mission areas that we want to make sure that we focus on that are most impacted by COVID-19: economy and employment, education and youth services, government services, health, human services, and housing. And as you can see, we'll talk about later, they are led by certain agencies and stakeholders. As you see, the Recovery Executive Committee, these are the broad areas that are included, the representations, and we can bring in other subject matter experts as needed. Again, these mission areas is a collaborative endeavor. So we do have certain agencies leading it, but they involve a lot more stakeholders and agencies in order to bring that expertise. And a lot of these stakeholders have community ties to make sure that we get the pulse of the community and their needs. And mission area, the work groups. Within these mission areas, if we need to have work groups that focus more on some of the details of these groups, we want to make sure that's included. So for example, the economy and employment, small businesses, restaurants, those are areas that might need more detail. And especially with health and human services and housing, childcare, eviction issues are really prominent. We want to make sure that they're focused on. So moving forward together, as I said, I think it's really important to note that response and recovery are concurrent because of the surges and because of the protective measures we have to take. And this framework is flexible and is scalable. The leads of the mission areas, I want to emphasize, are continually assessing the challenges of the community, the needs and the challenges of the community, and that's really important to understand. And again, with the continuous cycle of enacting policy level decisions, on that org chart is a two-way street. So the policy that's created is executed in those mission areas, but if the mission areas see a need for some policy or vision, that gets translated back up. And the recovery support team makes sure to provide that situational awareness to the executive committee and the mission area leads. So again, moving forward together, which is key, we are all in this together, making sure that we can realize this vision of making Anne Arundel County the best place for all. And again, engaging in this collaborative whole community approach in order to respond to the needs of the challenges facing all residents. Thank you.
Thank you very much, Preeti. I think it's a great overview for the work that county government is doing. We wanted to give the county executive an opportunity to talk about his thoughts on the reasons that we've sort of expanded this group a little bit to get additional feedback in a similar way that the groups within the framework that Preeti just described have been reaching out into the community to make sure we're hearing from as many people as we possibly can. County Executive, do you want to talk a little bit about the changes within this recovery work group that you contemplated and are already implementing within this meeting?
Yeah, I mean, we put this group together at a time when the governor was announcing pretty regularly his actions on the roadmap to recovery, the state Maryland roadmap to recovery, and learned that the way it was going to work was that counties would make their own decisions if they wanted to go a little bit slower, and he would open things, offer the opportunity to open things as he lifted restrictions. We needed to act quickly because those announcements were usually made on a Wednesday evening, and then we would meet on a Thursday and have to decide whether or not to move forward. So this was sort of like a strike team of people representing different parts. So instead of all of our chambers of commerce, we had one representative for all of them. And so I know that there were some concerns from some who haven't had an opportunity to be a part of this. There were concerns about the fact that it wasn't public, which obviously we're public now. And it wasn't an effort to hide anything. It was just an effort to move quickly and efficiently. And this group has done that and been extremely valuable to me. And I think to Dr. Kalyana as well, as a sounding board. But in government, the sounding board can never be big enough. And so what I'm going to do is continue to do these every other week, where we invite in different groups, panels from different parts of the community, open them up so people can speak up, ask questions, make comments as well. And then what Preeti just presented was 4 areas for the longer term recovery effort. And what we're going to ask all of you to do, as well as other folks, is to participate in those work groups, depending on which area you fit into, so that the work continues and we transition. I mean, we're still in recovery because we're always planning to recover, and we will. And as we look forward to the vaccination effort, we know that in the coming year we will be doing that. So we want to institutionalize this process and broaden it, and that's how we're doing it.
Thank you very much, County Executive. We're gonna head into the new part of the agenda for us so that we can open it up to some questions from folks who haven't been participating in the past. And at this point, I'm gonna hand it over to Jenny Prostal, who's gonna walk us through the folks who are in the waiting room wanting to ask questions of this group.
Thanks, Matt. So for our members of the public who have joined us on Zoom today, you'll see a raise hand button at the bottom of your screen. You can go ahead and click that if you'd like to give public comment, and then you'll be able to unmute yourself and share with us. You can go ahead and start raising your hands at this time.
Jenny, can you remind them the time limit?
Yes, we'll have about a 1-minute time limit for each person, so I'll cut you off with a timer once you reach that limit. We can get started with some comments on Facebook if nobody has raised their hand yet. I also see there's a question in the chat from Olivia. The 15,000 estimate projection is statewide, correct? I think that's for Dr. Kalyana.
That is correct. Yeah, it's a statewide projection.
I see a panelist has raised their hand. Donna, you can go ahead and unmute yourself.
Hello, I know that I'm a panelist and this is time for the community to ask questions, but in looking at where we're headed in the next wave, and I noticed under the economy and workforce development that there isn't a part there for workers and labor. And I think that that's a really important part of that development group. What we know and have found out that when workers are working with the business hand in glove, there is less spread and faster tracing. And those businesses are doing much better than businesses that have taken workers for granted. And I also think that we need to also not let down our enforcement of the workers that we're not seeing behind the scenes in restaurants and grocery stores, et cetera. There's somehow we have to make sure that they still have their coverings in the back rooms, even when they're coming out to the public, that those are not removed when they're with each other. So there's a lot going on, and we see now a lot more every day. I'm getting texts about more people being told to leave immediately from a place, not necessarily in Anne Arundel County, although Anne Arundel County Department of Social Services has had its own outbreaks at times. But people just being told, you know, take your things and leave. We've had somebody test positive for COVID. So we're still working on emergency temporary standards, which we're going to be putting forward in the legislature. And there is a great resource for any worker, and I would say for businesses too, on the AFL-CIO website. It's called Am I Safe at Work? And it outlines a tremendous amount of standards, what questions you can ask, what protections that you have. It's a really good resource for anybody. Am I safe at work?
Thank you. I see we have a question from Marta in the chat. What is Anne Arundel County's enforcement plan?
I can start on that, and then maybe Nilesh and others can jump in. We just had a meeting this week with all of the agencies that are involved in enforcement, both in Anne Arundel County and in the city of Annapolis. And it's slightly different. Bars and restaurants, for instance, in the county, the enforcement's been done by the liquor board, and they have a crew that responds to complaints. And I have to say that this is almost completely complaint driven, but plenty of complaints do come in. Some complaints go directly to the police department. Some go to the health department. Some go through the state complaint line. So the sources are pretty varied. And so the city of Annapolis is going to be, they don't have a team of health inspectors. They do it through, for their liquor board, they do it through their police department. And their police department has been busy doing other things. So they've deployed county staff just starting this week, I believe, to go out and do inspections in restaurants for compliance, bars, restaurants. So I think that's going to be helpful. The police department is the agency that handles any complaints that are not in a business, and then the police department often will accompany the health department staff. The liquor board haven't been utilizing the police department often. They only call in a crisis, but particularly the health department that's had to go in and cite businesses has met with some harassment in a number of cases and have had to have assistance from the police department. That's something that we can't allow our public servants who are out there doing that work to keep us safe to have residents or business owners interfere. For the most part, the business owners have been very cooperative, and people have been very cooperative with the police when they ask them to either disperse or put on a mask or social distance. So, but it's been a difficult thing, as you can imagine. And we've had county staff from across county government deployed into the health department to help them staff up to do the enforcement. And it's a challenge. And you want to add to that, Dr. K?
I think you covered it.
Thank you. I can go ahead and I'll take one question from Facebook and then go to Olivia, who has her hand raised. The first question, are there additional ways county leadership plans on aiding small businesses financially over the coming months?
We might get some help from Ben Burge on this one. We actually have our Economic Development Corporation, and I have to say that the programs that we have done, and there are multiple programs. The first was the customer and employee protection grant program for a few million that went out to help businesses open. Then the child care assistance program, now the restaurant program, have all been managed by EDC, Economic Development Corporation. And they have done a phenomenal job. They weren't set up to run grant programs like this, but they're doing it and they're doing it really well. But you could describe those, Ben.
Well, thank you, Stuart. I mean, you summarized them well. We put about little over $5 million out to small businesses in the summer through the Customer and Employee Protection Program. And that was to go towards equipment, anything related to helping businesses transition during the early days of the COVID response. So that was anything from plexiglass shields to cleaning equipment to laptops or network support to do more teleworking. Pretty much, it was pretty flexible. As you mentioned, we then put in place the child care support program, which we just put out our final report, which I believe is on our website if folks want to see that, which was about $3.2 million of support to both facilities and to in-home childcare providers, provided they were licensed by the state of Maryland. And then this past Friday, we opened the restaurant support and food service program, and that has had some really robust turnout. Like I said, it opened Friday morning. Here we are Thursday afternoon. We've received about 513 applications. I checked just before we started. And this is for restaurants, catering businesses, bed and breakfast, basically anybody with a dine-in seating, but not drive-through carryout. Flat $10,000 grant, and food trucks get $5,000. Basic criteria: have to have a Arundel food service license with Nalesh's signature on it. Have to have a W-9 and a voided check. That's about it. For those of you out there, if you know anybody in the restaurant business, make sure you reach out to them and tell them to apply. Like I said, out of the, we've had a little over 500 applications come into the portal. What's been the most amazing part of it, from my standpoint, being the head of the department, is our first line of review for all of them is completed, and our second line of review of them is complete. We have no backlog. We've reviewed every application that's come in so far. We have a few that are pending because sometimes people upload the wrong document or something like that. But we have no backlog. The team has been killing this. I can honestly say that if we had a deadline of May 31st instead of December 31st, we'd still be where we are. They're working that hard to get businesses the support they need. We're also bracing to see what the next federal stimulus looks like, because we imagine that you're going to give us a call, Stuart, and we're going to be cranking up the next grant program. But the team's really been working their tails off getting this money out the door. And we are in the process of finalizing. We just sent the signed agreement back up to the Department of Commerce this afternoon to get the governor's restaurant money in. So that's going to add to it. So we're looking forward to giving away more money to our businesses.
So we invested $5 million of CARES Act money. The governor's money, when it comes through, will be hopefully folded into that program, and that'll be another $5 for $10 million. And so those $10,000 grants, I think it's safe to say that if they're not all distributed in that first round at 10,000, that then we can go back, having pre-approved these restaurants and food service facilities, and increase the funds, because we know $10,000 is not going to solve the problems, and they can put it into wherever their greatest needs are, whether it's paying the rent, paying their staff, whatever they need to stay alive. It's to keep them in business.
That's a good point, because the grant from the Department of Commerce says working capital, which provides all kinds of flexibility for how the funds are used. And you're right about rent. That's the biggest one we've seen. When we ask what the funds will be used for, it's always the first word is rent. Some of the rent's pretty expensive out there.
Thank you. Now we have a question from Olivia. Olivia, you can go ahead and unmute yourself. You've got 1 minute.
Hi, thank you. I just wanted to ask a quick question about testing for the health officer. I think on Tuesday you said that some of the centers had to close early because of how long the lines were. I'm wondering how it's gone for the rest of the week since then, and whether you're expecting an increased demand in testing before the holidays.
It's been long lines. A lot more people are getting tested. So we made a couple of changes. We're switching to appointment only at a few sites, just so we can not have people in line waiting and getting frustrated. But we're also increasing capacity, so we're adding extra hours, particularly afternoon hours, at multiple sites. And we want to get people through and be upfront about what their wait time is going to be. So with those changes, we'll be better able to manage the increased volume.
Thank you. We'll take another question from Facebook now. Someone asked, what about helping people stay home by not letting their heat and water get shut off? Doesn't this situation justify a moratorium?
Kay, do you want to take that question?
Sure, thank you, Matt. Kay Augusta Brown, Chief of Staff. So we do have several programs that folks can take advantage of to assist with any utility bills that you have. If you want to connect with the Community Action Agency or call one of our food or COVID care line, they can connect you to the appropriate agency that will help to assess your needs and then connect you to the correct program. But we do have another program as well, which is the Water Bill Assistance Program that will help you with any, either to make payment arrangements or to assist you with accessing assistance to help take care of those bills. We really do want to make sure that everyone stays in their homes and make sure that they have housing and to make sure that their heat is on and to make sure that they have water. So by calling the 410-222-food, you can connect with an individual who will assess you for our many programs that will help not just utilities, but help to connect you so that you can get assistance.
Thank you. I see we have one last question from Olivia for Dr. Kalina Raman in the chat. Are there enough tests to meet the increased testing demand?
Yeah, we have enough tests.
Thank you. We'll go ahead and take another question from Facebook. This commenter says, I work for a grocery store, only sanitizes the store once a day. Why aren't restrictions tighter for retail stores with holidays upon us and crowds in stores?
I'll take that, yeah. I would encourage that person to call our health line, 410-222-7256. Tell us where you work, tell us what you're seeing, and that's what our enforcement team is designed to do, is to respond to that and come out and see what's happening.
Thank you. We'll take another question from Facebook. Someone asks what the orders going into place tomorrow are about.
Greg Swain, do you want to take that one? Our county attorney.
Sure. The order that we're preparing for tomorrow is, well, it does a couple of different things. It's going to acknowledge the mandatory 10 o'clock closing time for restaurants. We are going to be addressing some concerns that we had for gatherings for addiction recovery groups, which have been somewhat handcuffed by some of the social gathering requirements. And the third thing we're really doing is we are consolidating all the various requirements in this one order. So you'll be able to look at this executive order, which will be executive order number 38, And in that one order will be every restriction that we have imposed locally, rather than having to go to multiple orders. It will include some of the guidelines that we've put out for restaurants, indoor and outdoor dining, for personal service establishments, and some other restrictions as well. So as far as the new impact is really, I think, just pretty much addressing the restaurant closing and also some of the addiction recovery groups. And again, the last thing is just consolidating it all in one place.
And Matt, it's Chris Trummer. Can I just add for clarity, there's no new restrictions from the county side that haven't been announced. This is just, the new executive order is just to clarify how we will adapt the governor's announcements. And then remember to the questioner that our 25% restaurant capacity for indoor dining restriction, that goes into effect tomorrow at 5 p.m. So it was announced last week, but we gave restaurants some time to plan and get ready for that restriction. So nothing new on the county side that hasn't already been announced goes into effect tomorrow.
Thank you. Matt, I think we have time for about one more Facebook question.
Great, thanks, Jenny, go ahead.
I recently saw an article about how jurisdictions are spending down their CARES fund. What percentage of the county's CARES funds is spent or obligated in advance of the deadline?
I'm going to ask our acting budget secretary, Chris Trumbauer, to take that one at the moment.
Thank you. It's hard to give an exact number because a lot of the money has been awarded to grants and programs, but hasn't yet been spent. So we have monthly reports that are available on our Open Arundel portal that the public can view. But I can say generally that this county, Anne Arundel, is on track to spend down all of our federal CARES allotments. So our intention is to spend that all in Anne Arundel County on the programs and on the grants that we've got working. So we're not going to leave any money on the table. And I would encourage everybody to check that Open Arundel portal every month if they want to get an update.
Thank you very much, Chris. Two closing thoughts on my end, and then I'll hand it over to the county exec for the last minute. First, I want to thank all of our panelists, as always, for your valuable advice and feedback. And even outside of this meeting, we hear from all of you. We text with you, we email with you, and the frank and candid feedback that you provided us over these many months has been critical for the administration to try and get it right. It's unfortunate. It was a lot more fun when we were talking about reopening and debating those things than the situation we're in now, which is unfortunate. But your advice is extremely valuable to us, and it was really great to hear from some folks even beyond this group, and I'm sure that the panel enjoyed hearing from the community as well. With that, I'm going to hand it over to the county executive for last and closing thoughts.
Well, I would thank everybody who's been participating in these. I mean, I think we put together a really strong team that was representative. You know, having Donna Edwards from AFL-CIO representing workers, having Eric DeVito, who's not only the chair of our Economic Development Corporation, but works with one of the large commercial landlords. So was able to give us a lot of the perspective about what's going on out there in commercial real estate as a result of the pandemic. And then Bishop Antonio Palmer, representing the faith community, has been really valuable in advising us on what's going on in our churches and synagogues and mosques around the county. And then we've had both of our amazing, I have to say, our healthcare heroes really are heroes. And this must be a scary time for you all, but we have Sherry Perkins, who runs our Anne Arundel Medical Center, and Karen Olskamp from Baltimore Washington Medical Center. And both of you have been invaluable in this process and are going to continue to be, I'm sure. And then having Councilwoman Amanda Fiedler from the County Council, as well as Councilman Andrew Pruski, have been kept it lively and made sure that the discussion has every perspective. It's been really important. And so, I mean, these are all people we're going to continue to talk to. Who did I leave out? I'm sure I left out somebody. Maybe not. Anyway, these are people we're going to continue hearing from because they're some of the smartest folks in the county. And I just want to thank all of you for the work that you've been doing. So it's going to be a difficult winter, but we will continue to do everything that we can to help the residents of this county and protect each other. this virus. So stay strong, everybody.
Thank you, County Executive. Thank you, everybody. The FAQs are updated on our website for those who want any additional information. Stay safe, stay healthy. Thank you.